Well, so I grew up on Yorke Peninsula, and then I went away to boarding school and then uni interstate, but then came back here because I married my husband and he's a farmer, so he's not very portable. But we actually really like living here, so it's there's lots to do, so good beaches and places to go camping, and also the community as well. Quite involved in different community groups and sporting groups, so that really keeps us connected, I guess. And then we've got a couple of little kids too, so really happy that they get to grow up with lots of space around them and the communities around them as well. So I was attracted to working here because it's really different to Metro GP, I guess. So when I was going through medical training, I liked different specialties, but I didn't really want to limit myself to one. So I quite like working in general practice because you get to treat all ages and genders. But then rural practice allows you to work across the clinic and the hospital and aged care too. So you can sort of do the emergency work and the clinic work and follow people all the way through. So it'll be a unique training experience for our trainees because they won't just be part of big subspecialty teams. They'll be having hands-on patient care. They'll be able to assess and manage patients with their supervising consultants, and then be able to learn those procedures that are usually reserved for the more senior members of the medical team. So this is a new and exciting program. So we're creating rotations that are going to be across the network in lots of different areas. So trainees will be able to work with us to be able to personalise their experience. So we want to know what sort of experience trainees want to have and where they would like to be based, so that then we can tailor the experience to them. We also really want them to be able to have a focus on their educational opportunities, but also have a really good life outside of work. So that's why we're doing minimal weekends and night shifts and overtime, so that trainees will be able to explore the region, hopefully get involved in communities or pop back to Adelaide because it's really not that far away. Trainees might only stay for a year, but we would love it if they love living and working here so that they become colleagues and locals one day too. It's the best of both worlds. We get to be close to Adelaide, but then have a really rewarding and fulfilling job in a community that I love, and then there's heaps to do on weekends. We explore beaches, go camping, fall driving. I've got a distillery around the corner, which is pretty handy, and we've got lots of family nearby too.